Imagine feeling perfectly healthy, with no warning signs, until a routine checkup reveals unexpected news: prostate cancer. The reality is that this disease affects 1 in 6 men and, in most cases, develops without obvious symptoms in the early stages. When the signs finally appear, it is often too late for a simple and definitive intervention. Here's why ignoring these symptoms can cost you dearly. But don't worry, today you'll discover the 7 most common signs that your prostate may be in trouble, 7 signs that your body may have already given you and that you can't afford to ignore. Some of them will surprise you, others will make you think. But one in particular could be the key to saving your life. Prostate cancer is one of the most insidious. It grows slowly, silently, without being noticed, until it is too late. And the truth is that often the signs are there, but they are ignored or confused with minor disorders. Watch the video until the end, because in the last part one will reveal to you an incredible story of a man who discovered the tumor in time and changed his destiny. Write in the comments, "Protect prostate, perfect life," as a commitment to yourself. And if you care about your health, leave a like, subscribe to the channel and activate the bell so you don't miss other content that can literally save your life. Now let's get straight to the point. What is the prostate and why is it so important? The prostate is a small, walnut-sized gland located under the bladder and in front of the rectum. Its main job? To produce seminal fluid, which is essential for male fertility. But when something goes wrong, the prostate can become a serious problem. And prostate cancer is the most common cancer among men over 50. According to the WHO, 1 in 6 men will be diagnosed with this cancer in their lifetime. Yet, many men don't think about it until the symptoms become too obvious. And by then, it's often too late. Here are 7 signs you shouldn't ignore. 1. Weak or intermittent urinary flow. The first sign to keep an eye on is the way you urinate. If you notice that your flow has become weak, discontinuous, or intermittent, there could be a problem with your prostate. Imagine opening a faucet and seeing the water dripping instead of flowing. This is one of the most frequent warning signs. It is not always a sign of cancer, but it is still a symptom that should not be ignored. Sometimes, very young men tend to downplay it, thinking it is a temporary inflammation. But it is essential to talk to your doctor, because only with a professional evaluation will you be able to understand what it really is. 2. Frequent need to urinate, especially at night. If you often find yourself waking up in the middle of the night to run to the bathroom, you may be dealing with a condition called nocturia. Sure, it can happen to anyone to get up once or twice to drink a glass of water or for other reasons, but if the frequency becomes constant and the cause is the bladder always on alert, it is time to investigate. This signal is closely related to possible prostate problems, because when the prostate becomes enlarged, it can press on the urethra and alter the normal flow of urine, creating the sensation of having to urinate continuously. 3. Sensation of bladder not completely emptied. You know that annoying feeling of still having to go to the bathroom, even after having just urinated? It is another common symptom of possible enlargement of the prostate or abnormalities that hinder the normal flow of urine. Feeling your bladder still full can be really frustrating, and if this discomfort persists, it is best to check with specific tests to rule out serious pathologies. 4. Blood in urine or semen. When blood appears in the urine or semen, the alarm must go off without hesitation. As scary as it may be, it is not necessarily a sign of cancer, but it is a signal that should always be taken seriously. There could be inflammation or small polyps, but there could also be more serious problems, including tumors. An expert will be able to direct you towards specific tests and checks to understand the cause of the bleeding. 5. Pain or burning when urinating. Many men underestimate this symptom, often confusing it with a urinary tract infection. And in fact, it could be an infection or prostatitis, an inflammation of the prostate. However, in some cases, behind these simple symptoms there may be a more serious problem. If you experience prolonged discomfort while urinating, do not hesitate to talk to a doctor. 6. Persistent pain in the lower back, hips or thighs. Prostate cancer, especially in its more advanced stages, can spread to nearby areas, such as the bones of the lower back, hips, or even the thighs. This can result in persistent pain that does not go away with common painkillers or that appears mysteriously for no apparent reason, such as an injury or a sudden movement. If your back pain becomes chronic and does not seem to respond to standard treatments, it may be worth investigating further. 7. Sudden weight loss and extreme tiredness. Unexplained weight loss and constant fatigue are signs your body is sending you that something is wrong. It's as if your body is fighting an internal battle and using up its energy reserves. In the case of prostate cancer, or other types of cancer, these symptoms may occur because the body is using up a lot of resources to deal with the disease. Why does the prostate go into crisis? Risk factors. Now that you know the 7 signs, you should know that there are various risk factors that can increase the chances of developing prostate cancer. Here are the main ones. Age. After the age of 50, the risk increases significantly, and after 65 it becomes even higher. Familiarity. If there have been cases of prostate cancer in the family, father, brother, grandfather, the chances of developing it increase significantly. Ethnicity. Statistically, men of African origin have a higher risk of developing aggressive forms of prostate cancer. Unbalanced diet. Regular consumption of red meat, ultra-processed foods, and saturated fats can increase the predisposition. Conversely, fruits, vegetables, and foods rich in antioxidants offer additional protection. Obesity. Being overweight, in addition to promoting other pathologies, is related to more aggressive forms of cancer and greater difficulties in treatment. Sedentary lifestyle. Little or no physical activity weakens the immune system and promotes chronic inflammatory processes that can promote tumor growth. Smoking and alcohol. Tobacco introduces toxic substances that can damage cells, while alcohol abuse causes inflammation and exposes you to various forms of cancer. Matthew's story, how a timely discovery saved a life. Matteo, a 56-year-old man, led a normal life. He loved his job, went out with friends, and didn't worry too much about his health. One day, he started noticing something strange. He had to get up often at night to urinate. He felt a pain in his back that wouldn't go away. She had lost a few pounds, but she thought it was because of the diet. He didn't give it any weight. It's normal with age, he thought. Only after months of increasingly bothersome symptoms, he decided to have a checkup. And there was the discovery: he had prostate cancer, but fortunately it was still in an early stage. Thanks to an early diagnosis, she was able to undergo less invasive treatments and is now doing well. But what if she had waited longer? This story teaches us something fundamental. Listening to your body's signals can save your life. Now that you know the signs and risk factors, don't just sit back and watch. Book a checkup with your doctor, especially if you are over 50. Share this video with anyone who might need it. Write in the comments if you know someone who has had a similar experience. Want more videos on health and prevention? If you want to support our work and help us create increasingly useful content, you can do so with a small contribution. Just click on the thank you icon that you find right under this video. Every support you give helps us spread information that is essential for everyone's health and well-being. Subscribe to the channel, activate the bell, and see you in the next video. Remember, prevention is always better than cure.